Hi students, today we are going to see the median nerve. I'll just revise this, and first we should write for the essay or short note, whatever it is, we should write whatever nerve is asked, we should write the subheadings as commencement, course and branches and clinical application. So commencement for all the nerves you should write. For example, for high we have started with median nerve, so the commencement from where it comes. So the lateral cord and the medial cord, the lateral root comes from the lateral cord and the medial root comes from the medial cord of brachial plexus. So this is the commencement, and where it lies, the course in the axilla number. Course means where it is going. Course, first side heading should be it's in the axilla, second side heading it is in the arm, third in the cubital fossa, and fourth in the forearm, and fifth in the carpal tunnel, and sixth in the palm. Like that you have to put the side headings. So first we will see the number 1 course in the axilla. Axilla, where it lies. So you can see here nicely it lies. Can you see the median nerve is here? So nicely you can see the median nerve is here. It lies just lateral to the medial cutaneous nerve. Can you see the medial cutaneous nerve of forearm? Just next to that is the median nerve. So axillary vein is there, axillary artery is there, so median nerve is located here. And then if you see, you can see the axillary artery very well here. So it lies lateral to the third part of the axillary artery. You can see the artery. I have lifted the axillary artery number 1, and then it crosses the brachial artery from lateral to medial side. So like that, initially it will be laterally placed, then it crosses medially and lies in the cubital fossa. So in the arm, what are the branches given? No branches. So median nerve in the arm, it doesn't give any branches. So it is in the arm. Then we will go to the forearm. Now you can see very well. See how nicely the nerve is crossing the artery. You can see very well here. So from lateral to medial side it crosses. Because why lateral to medial? Medial only in the cubital fossa. It is going towards the cubital fossa. So it should be occupying the medial most portion in the cubital fossa. And then third in the forearm. Forearm, you can see the cubital fossa boundaries here. Brachioradialis is seen here, and the pronator teres is seen here. So this now comes here and passes between the two heads of the pronator teres. It is entering inside. Then after entering inside, flexor digitorum superficialis muscle is present here, and the big muscle takes its origin from the humero-ulnar head and a radial head. Can you see this U-shaped arch? Beneath that U-shaped arch, that median nerve enters. While entering inside, it gives a branch called anterior interosseous nerve, which goes deep. What are the deep muscles present there? So it supplies the deep muscles, flexor digitorum profundus, that to the lateral half, because medial half is supplied by the ulnar nerve. We will see in the ulnar nerve video. And flexor pollicis longus and pronator quadratus. These three are the deep muscles that everybody knows, and terminated by supplying the nearby joints. Always you should write the articular branches. This is called articular branches. These are all called muscular branches. The main branch of the median nerve supplies. Main branch supplies all the superficial muscles. What are all the superficial muscles? This pronator teres, flexor carpi radialis, and pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi, and that ulnaris is not supplied by the ulnar nerve. So these are all the other superficial muscles. So superficial muscles supplied by the main branch. Anterior interosseous nerve supplies only the deep branches, and terminates by supplying the inferior radioulnar joint, because it is present at the bottom. So here only you will be having the inferior radioulnar joint, and then radiocarpal joint and intercarpal joints. Then it lies over the flexor retinaculum, the lateral part of the flexor retinaculum. We can see nicely a canal called Guyon's canal. Here nicely you can see the canal called Guyon's canal, where the ulnar nerve and the ulnar artery is coming. Okay, can you see this ulnar artery and ulnar? This area, the canal is called as Guyon's canal. It is nothing but the flexor retinaculum slip will be overlapping this. So it is called the canal, ulnar artery and ulnar nerve. They will ask you the relations here. Ulnar nerve is always medially placed, and ulnar artery is laterally placed. This is towards the thumb. So this is your lateral. So this is medial. So sorry, we are talking about the anterior interosseous nerve, and then median nerve enters into the flexor retinaculum. Flexor retinaculum, you just see that it lies below the flexor retinaculum. Below the flexor retinaculum means where it lies. These are the carpal bones, and here is the flexor retinaculum. So this tunnel is called this carpal tunnel. Carpal tunnel. In the carpal tunnel, it lies between the radial bursa and the ulnar bursa. Radial bursa is a sac which contains the flexor pollicis longus tendon, and ulnar bursa is the sac which contains 4 flexor digitorum superficialis and flexor digitorum profundus tendons. Sorry. And then last one, okay, you can see that. So in between these 2 bursa, you could see the median nerve passing through that. Before entering into the carpal tunnel, it gives a branch which goes up the palm called palmar. You can see this palmar cutaneous branch of median nerve. Before entering into the tunnel, it gives a branch. After entering into the tunnel, you can see the median nerve clearly here. After entering into the tunnel, it goes here. So what are the branches after entering into the tunnel? It gives. So you can see the branches here. Number 1, first see the median nerve is coming here inside, and here you have the thenar muscles. Okay, so thenar muscles, it gives supply to the, it supplies the thenar muscles and goes here and splits into 2. This branch is called the lateral branch, and this side branch is called the medial branch. So the lateral branch goes here and both the sides of the thumb. Another one branch goes here and supplies the lateral side of the index finger. Now the second medial branch already it divides into 2. See, the first lateral branch only is MCQ. This is MCQ. The first lateral branch goes here, no, that supplies the first lumbrical. The branch, second medial branch only supplies the second lumbrical, and it divides into 2 main trunks, and they supply the adjacent sides of the index and the middle finger, and adjacent sides of the middle and the ring finger. So totally 1, 2, 3 and 3.5. So totally 3.5 fingers. It supplies the palmar aspect of the 3.5 fingers. So what will happen if the nerve is injured? So what are all the areas possible where the nerve can be tracked? Okay, when it pierces the 2 heads of the pronator arteries, or when it lies beneath the arch formed by the flexor digitorum superficialis. So what are the things happen? Otherwise, the most important structure applied anatomy called carpal tunnel syndrome. These areas, they are more prone for injury. If it is injured, what will happen? So the median nerve mainly it supplies the flexor compartment of the forearm and the thenar muscles and the first 2 lumbricals. So pointed index means they are not able to flex because the flexors are all paralyzed. So what will happen? In the index finger will be not able to flex, so it will called as pointed index. Second, ape thumb deformity is the opposition. The thenar muscles are called 3 thenar muscles I have drawn here. Number 1 is flexor pollicis brevis, abductor pollicis brevis, and opponens pollicis brevis. 3 muscles are there. The opposition of the thumb takes place at the carpo-metacarpal. See, this is called, see, opposition. This movement is called the opposition. This is done by the carpo-metacarpal joint. So this is not possible for this median nerve injury patients. So what will happen? They will not be able to do the opposition. So what will happen? The thumb will be put by the side of the palm, and the second thing is your thenar muscles will be paralyzed. This is called thenar muscle. So what will happen? This will lead to ape thumb deformity. The thumb will be looking like the thumb of the ape. And then carpal tunnel syndrome is the tunnel. Already the tunnel is very narrow place. Can you see that? If any of the carpal, mostly the lunate is more prone for dislocation. If the bone is dislocated inside, already the space is very minimal, or in pregnancy or in myxedema, these cases this tunnel will be filled with the extracellular fluid or connective tissue. That time this nerve will be getting compressed. So this is called as carpal tunnel syndrome. So if the nerve is injured, what will happen? Again the same problem. These thenar muscles will be paralyzed, and the first and second lumbricals will be paralyzed. So if the first and second lumbricals will be paralyzed, so third and fourth lumbricals and other interosseous there, so metacarpophalangeal movements will be normal. So mainly the thenar muscles will be paralyzed. That will lead to pointed finger, ape thumb deformity, and carpal tunnel syndrome. These are the clinical applications you are supposed to write. Thank you.